So without further ado, Mark, would you show the Smart City video? We're only going to show 2 minutes of it, or about a minute and a half. And after that, we can start the discussion. Thank you.
Definitely.
In Côte Saint-Luc, 30% of the population are seniors.
Where the rest of Canada is going, we have been for decades.
We are now the living lab for the future.
So what we do here in Côte Saint-Luc will help all cities throughout the country.
The city's in the business of delivering service. We do it well, but it's not enough.
The society that we live in is not designed for seniors.
And that became our challenge.
We will implement a connected framework that will enable seniors to live more independently in their homes and communities, such as motion sensors, a fall detection device, our connected mobile app, and more. Say you live alone, you may only have limited resources for help. The Connected Village allows you to access resources when you need them. Imagine getting out of bed at night and having the lights turn on automatically, reducing your risk of injury. What if you're walking outside and happen to fall? A simple wearable could monitor the situation and trigger an alert to city services, or even better, to someone who might be physically closest to you in the moment who can respond quickly. Or perhaps you left the stove on. A level of response could be anything from a device that automatically shuts it off to a call to check in on the situation, making sure that you and the residents around you are safe and sound. The Connected Village could also help you with your social engagement. You could receive reminders of upcoming activities at the library or local theater, and even arrange for a lift. All of this could be made part of your personalized plan in the Connected Village.
There's opportunities here to save people who are healthy, who just have one moment of inattention.
Dita?
Yeah, sorry. That was just a short clip of a 5-minute video that introduced our project to the jury. We were going for the $10 million prize. We didn't get the prize, but we got a lot of very strong reaction from government agencies and community groups and research partners and so on and so forth. So what we did with that is we were highly solicited to continue this project. As you can see, it's very relevant, especially during COVID. And as a result, what we did is we went back to our partners, the research partners that we worked with, and we teamed up with them to apply for a $1 million grant. It's almost $1 million, a little over $800,000. It's a 3-year grant. It was reportedly reported in our Inside Out magazine, Côte Saint-Luc to become a living lab to support isolated seniors. And the grant will help the city advance the goal that we set for ourselves in 2019. Basically, it's to promote healthy community engagement and put in 20 pilot projects, like introduce these technologies in 20 homes of seniors and allow them to live safely at home and be connected to community. So I think you have the general idea. What I would like to do at this point is invite Mark just to get the ball rolling so he can give a little introduction. Then David can speak to it as well. I just spoke to Maxine on the phone. She forgot all about it. So that's a senior moment. Let's put it that way. And we'll see how the conversation goes. Now, again, I repeat that there are many people who haven't turned on either their mic or their video, and I'm asking them now before we start the session. I think it is elementary politeness to either turn on your audio or turn on your mic, your video, so that we can see who is on this call. This is, you know, it's supposed to be a informal conversation. It's not a session that is, thank you very much. Hi, Maxine, there you are. How you do? So Charles Ilrich, Jerry Brownman, Eric, I really would appreciate if you would either turn on your mic or turn on the video. And if you don't want to do either, well, then I would invite you to leave the session, because I just feel uncomfortable with having so many people on and not knowing who we're talking to. It's just not comfortable for us. So I'll give you 30 seconds to do that. If it's not done, then that'll be, you know,
Dita, I have absolutely no problems, but hi.
Hi,
I'm just moving around. I have you.
fine. I see you.
I'd like to listen
are,
in to
and
what you're
that's-
saying, but I just don't want to hear you.
Right.
There's lots of background noise and whatnot, and I'm trying to be
Okay.
polite and not cause
Okay.
disturbance or anything else to anyone else. So that's
I'm
why
okay
I
with
typically put
that,
myself
Eric.
on mute.
Thank you very much. Jerry Brownman? No response. Charles Ilrich, no response. Thank you for coming. We'll see you next time. Okay, so Mark, do you want to get the ball rolling?
Yeah. Okay. Should we? All right. Yeah, I'll get the ball rolling. So I've been just give some background quickly. I've been.
Can everyone see Mark? Because I'm on speaker view.
Yes, definitely.
Okay, perfect.
Okay, great. To give some background, I have been working with the city and under Dita's leadership for a few years now, since 2018, where we really mapped out a pretty unique, as a collective, as a great team working on this topic, built a vision that was really highly regarded and recognized at the federal level in the context of the Smart Cities Challenge, where the city was awarded $250,000 and was up for a $10 million prize. And I had the privilege of having a leading role in defining the vision that was going to position Côte Saint-Luc in as a municipal leader for empowering seniors to live at home in the future longer than is traditionally possible. So that what we did is for 6 to 8 months, we really worked hard with a lot of residents in Côte Saint-Luc, with a good handful of residents in Côte Saint-Luc and our partners of the University of Montreal and the University of Sherbrooke and other partners as well, including the CIUS, Centre-Ouest, and Dr. Rosenberg and other influential people at the healthcare level, who helped us map out a vision of what it would mean to bring care and services to where the patient is. Basically, that we were, I find it really important to say how we were visionaries in 2018, 2019. So right before COVID, mapping out a vision for what would be that people would get care where they live and not have to constantly drive out to or find their way to the hospital and other healthcare locations. So just want to share that this vision of empowering seniors to live at home in safety and security with the help of technology is what we put together. And I have to commend the city and Dita's work and other members of the team at the city and council for continuing on this journey, because the current Living Lab project is really aimed at continuing on this vision and seeing that there can be, with the help of technology, a way to be connected from home, right, and for people around you around older adults to be connected to the services around them and to different other places. Right. So there's a pretty interesting initiative that is starting now that is going to be aimed at that direction, and it's very exciting.
Thank you very much, Mark. And I'd like to ask David at this point to talk a little bit about the grocery project that he launched in collaboration with Councillor Kujawski in 2020, yeah, right after the pandemic hit, because we had so many isolated seniors and they were literally stranded at home. They couldn't, buy their groceries. So you want to talk a little bit about that?
Absolutely. Thank you, Gita. I can't believe it's been over a year, but basically in March 2020, if we'll all remember, our seniors were asked to stay home, and while that was obviously for the benefit of their health, because no one really understood the nature of the pandemic, the nature of the virus. It was there were really no contingencies made for them. There were no services available to them. As now we look back and we look at groceries being ordered online as being commonplace, but at the time we were faced with two problems. Number one, the systems at our grocery stores weren't as robust as they are now. And frankly, our seniors had no idea how to use a tablet, how to use a computer, how to order groceries online. So I'm sure you've all heard this many times before, how accelerated our digital lives became. This was an extra task in Côte Saint-Luc, because as we saw in the video, we have the highest proportion of seniors who were all asked to stay home. So what happened? So Councillor Kajavsky contacted Melissa Margulies, who in turn contacted me. We run a private foundation, a public foundation actually, called the Nelly Philanthropy Foundation, and said we have to do something for seniors. So we approached Peter Lapari at the Côte Saint-Luc Shopping Center, IGA, who was only too accommodating to help us make sure that every senior was fed in Côte Saint-Luc. So we mobilized, and this was, really, there was no precedent for this, which is, just right up Nelly's alley. We call ourselves the first responders of philanthropy. And we mobilized 200 people right away. They came to us. We just kind of put it out there that this is what we were doing. And right at the beginning, in March of 2020, we were at IGA 7 nights a week, packing groceries and bringing it to seniors. As the months progressed, the culmination was around Saint Jean Baptiste in 2020. We were first at 7 days, and then we went to 5, and then 4, 3, and then we reached a point where we were doing 2 days a week, and then we decided that it was time to wind down the program with the proper quote unquote training of our seniors. But I will never ever forget the if anyone has been to IGA before, I know we all have, just the red car order bins stacked along the wall at the Côte Saint-Luc Shopping Center. There had to have been over 500 of them at the time. And just the delivery drivers, it was a well-oiled machine, thanks to Mitch Councillor Kajavsky, his sister Pam, Melissa, and I had the honor of participating, and it really was an unbelievable outreach and an unbelievable organizational endeavor, which we will never forget. But most of all, the one thing I'm most proud of is one of our volunteers, Leslie Ornstein, made sure that every senior who we helped, we didn't abandon anyone.
Right.
We left, our motto was, leaving no senior left unserved. And what ended up happening was she reached out to every single senior to make sure that at least if they weren't capable of ordering themselves, because by then, by June or July, everyone was ready.
You had to climb down, right?
Everyone was.
But you have now a list.
I'll just finish with this. The IGA and Provigo and all of the stores at that time were ready to accommodate our seniors. But she made sure that if the seniors themselves didn't know how to do it, that there was someone, either a friend or a child in Canada who was able to order for them. So every single senior in Côte Saint-Luc who we helped was able to order groceries on their own before we wound down the program, which, as I said, was around Saint Jean Baptiste in 2020. So very proud of that. Very proud of the assistance that the city of Côte Saint-Luc gave us. Public Works was there. They helped us deliver when we were doing it 7 days a week. Sometimes volunteers were thin, and we had the support of council, and it was a labor of love for all of us, and it really propelled Nelly onto the stage now where we're taking in all sorts of other programs, including Dara Faith, which Dita knows very well, where we're making sure that less fortunate kids and seniors have electronic equipment to enable them to participate in our digital world. So we're very proud of that. We could not do it without the support of the current council, and I'm just very proud of everything we've been able to achieve.
Thank you very much, David. For me, all of that was a great success, but now looking forward to this Living Lab project, I see two takeaways. First of all, that you have contacts now with a lot of isolated seniors. I mean, people who are literally living home alone. And so those could be good candidates for our pilot project. We're looking for 20 people on the spectrum of, with either handicaps or mobility issues or, other health issues, so that we can definitely talk about that. And the other one is a slide before I go to Maxine and the mayor. It's a slide that Mark and I worked on when we presented to the Cummings Center, and he's just going to flash it on the screen. And it really speaks to what we just went through in COVID. What we all went through in COVID is that, and here it comes, is that COVID-19 yanked telehealth out of the future and into our daily lives. We never even realized, how we were going to use telehealth or how we were going to be connected until we had this, COVID experience. So to me, it's an opportunity. This COVID-19 has been an opportunity to really push us forward. Thanks, Mark, for the slide, to really push us forward and to leap forward into an age where the city is going to become a platform that's really going to assist seniors, and not just for telehealth, but for many of their other needs. And so that they can stay safely at home. I'm doing my door-to-door, and a lot of seniors say, I'm not going into a CHLD. I'm not going to senior residence. I don't want to get COVID. I want to stay at home. Mitch's mom is one of them. So that's where the city comes in helping these seniors really be able to stay at home by using technology. So Mitch, if you don't mind, I'm going to go to Maxine first, and then I'm going to let you comment. Okay, go ahead, Maxine. Thank you for being here. You're on, Maxine.
I know. Listen, I don't know what you want me to tell you. We had a very, very successful conference on aging at the Cummings Center, as you know. Dita was part of the program committee, and Mark presented for us on the segment that we did on digital and virtual telehealth and, virtual help for seniors. It was a very, very well received segment of the conference. It again, at the time, lasted a year ago, last January. My God, it's almost a year ago. How time does fly when you're having fun. It was quite innovative. For people heard about it and they were blown away by it. And since then, of course, I think it's been wonderful. I've had a couple of doctor's appointments online that truthfully I really appreciated, because with the computer and a face, I didn't really have to be waiting in any waiting room for hours to see somebody. And they could pull up all the records and all the tests that they needed to see on the computer. So the network is working brilliantly. And I see great things for it going forward for seniors. I think one of the bugaboos, and David just mentioned it, was getting people equipped. That's one of the things that Cummings has been struggling with it as well. We have wonderful online programming. We have done a phenomenal shift to the virtual world, and we have many, many programs, but we want everybody to be able to access them. And that's been one of the things that we, we're struggling to work with. So David, when I hear you trying to get electronics into the hands of people who really need them and then having somebody help them, that's great. Our IT department has done a phenomenal job helping people who do have equipment use it. So I think it's a thing we can work on together, perhaps.
Yeah, thank you. Yeah, I totally agree. And I've been very supportive of David's initiative to try and recuperate and recycle some of the tons of electronic waste that we collect in Côte Saint-Luc. I've brought it to council. Council agreed in principle. Now the staff is looking at it, and we're going to try and find a way to sort the electronic waste that is recoverable from the electronic waste that is going to get crushed and not reused. And I think it would be very, very important for Côte Saint-Lucers to know that if they're getting rid of a mouse or a keyboard or a phone or even a laptop, but the laptop's more difficult because of confidentiality issues. But we want to try and sort out those pieces of equipment out of the electronic waste, because we do send tons of equipment to be crushed and not to be reused, and it's a loss. So that's another subject. Yes.
I would suggest that we publicize the fact that we're looking for that. I have an iPad sitting here that I'm not using anymore.
We're very, very aware of it. David and I have been working on this for the past.
I have an old laptop in Florida that I'm going to bring home that's been refurbished by a friend of mine. We just bought a new one. So I'm not going to leave it there. I'm going to bring it home and I'm going to give it to you.
We appreciate that. And
everybody needs to know this. That's the point.
Right. Well, we need to get it through the city services, and we're working on it together. We've been working on this for almost 8 months now. We're trying to move it forward. So we hope it'll happen in the next couple of months. So now I'm going to go on to the mayor, Mitchell Brownstein. Thank you very much. Go ahead, Mitch.
Yeah, no, it's great being here. One of the most exciting things that I was involved in was the Smart City Challenge. When it was before COVID and we were doing all these things and it sounded so great. We never thought we'd be hit with the pandemic, but all the things that we were doing in the Smart City Challenge, and only if we could have won the $10 million, we would have been able to prepare so many of the seniors for the pandemic. I mean, it's not only protecting them in terms of lights that open at night, or knowing how to speak to Alexa and call emergency, or your daughter or son, but it was also teaching them how to use things that we think are so familiar now, like Zoom and the internet in so many different ways, and ordering your food online. So all this stuff is really related to what Mark and Dita and our whole team were working on in the Smart City Challenge. And now that we're going to be having this living lab, I really feel that we need to move that forward. We need to find ways. We have this grant, it's a living lab, but we need to then find other grants where we can actually take all that work that we did, because we really have a framework. I mean, you didn't show the whole video, but Mark worked at this whole framework of what would a home look like for a senior living alone that would really keep them safe and connected to everyone that they need to be connected to, their friends, their family, emergency, anything that they need. And it's quite a remarkable project. And just, we won $250,000, which was great. And it enabled us to get to a certain level. And now we have to figure how to get to the next stage. So the first step is the living, we have this other grant, which is great. We'll have the 20 people or so in it. And then we need to look to see if we really want to make Côte Saint-Luc a place where 30% of our population are seniors, and we want them to be able to have that choice to live at home. We have to see how to get there next. And I think we've done we're on that journey, and it's been a lot of fun doing that journey. I think it's been really enjoyable for everyone, and I look forward to the next steps. And congratulations to you, Dita, to Mark, Tanya, and all the whole team. And
the
David,
whole team.
David was great with Mitch and Pam and Melissa. And
but even this last grant that we got, I mean, was really collaboration with our partners that we had, the research partners that we worked with last time. So they saw tremendous possibility here in Côte Saint-Luc. We're a great platform for that. And I obviously pushed in order to get that grant. Now, I have some questions on the chat, and I'm wondering if, since quite a few people didn't see the video, I wonder if we couldn't just show another 2 minutes of it, if people are interested, because
I think the whole 5 minutes was great for people who didn't see
I
it.
know, we just,
Amazing video. It's
it
only 5
is,
minutes.
it's amazing. So Daniel's asking, I understand the objective. Can you tell us precisely what things Smart City will allow the elderly to do, what we couldn't do otherwise? So that's basically it. I mean, if you understand that you're going to put smart devices in the home, they're going to allow you, but first of all, you'll be monitored, so we'll know if you flush the toilet in 24 hours. I mean, these are really for people who are living alone. If they opened the fridge in 24 hours, if they left the house in the last 24 hours. I mean, if they fall in the house, all these things that now are monitored separately, you can have a smart watch, or you can have some sort of electron, but this is more integrated. Do you want to see the rest of the video?
Why don't you show the whole thing? I think it tells everything that you're trying to tell. It tells better than you can tell it.
Obviously, it was a great video. Okay, is everyone game to watch it? It's only
the whole thing's 5 minutes. I don't know where you're starting from now.
Okay, so yeah, let's go. Okay, so Mark,
watch the rest wherever we were at.
Okay, where we...
On peut imaginer la technologie un peu comme un bon voisin, c'est-à-dire quelqu'un qui est là en soutien, sans être envahissant.
And connect our seniors to the social services, to the medical services.
Seniors want data from technology to be used appropriately and according to their wishes.
Parce que la ville a une mission sociale qui est de soutenir ses aînés. Elle a une grande crédibilité auprès de la population, donc ça nous permet de mettre en place des systèmes innovants tout en ayant la confiance aussi du public.
With the Smart City project, we will be able to keep patients at home, keep them in a healthy, secure environment, keep them out of the hospital if they don't need to be here.
We have to adapt to those seniors who want to have that confidence that they can stay in their homes and still feel comfortable and safe.
I preferred living at home. I tried out one of the residences. I didn't love it, so I came back home.
The future's technology. I would like to see that. I'm counting the days.
Today, we can start to do something to make everybody's life better.
I think anything you can help, any little thing, is so appreciative.
There are situations where people might not need these solutions today, but they will need them tomorrow.
I think the city of Côte St. Luc's and our vision of moving care to wherever the patient happens to be are totally aligned.
On va pouvoir raconter un peu une histoire autour du projet de Côte-Saint-Luc de façon à ce que cette histoire puisse se répéter. Nobody should ever have nobody written at the top of their care map.
We're the perfect place to implement this technology to ensure safety and good health and connection with community through the Smart City Challenge.
You're on mute. It
Sorry.
would be a dream to have it. It's a dream. I want to see this happen.
But this new project that we've got, this new subsidies with the same researchers, and we're going to move it forward over the next 3 years. We put out a call to all community groups who service seniors to come and sit around the discussion table and define exactly where we need to go. I think we defined it quite well already when we did our Smart City Challenge, but we're going to ask for more definition, and certainly because of COVID, we're going to refine everything that we want to do. I see that some other people have joined us. I recognize their names, so welcome Heather, welcome Gloria, welcome Vicky. Is there anyone else who wants to ask a question? Daniel, did you get a response to your question?
Eric has his hand up.
You're on mute, Daniel.
Yes, I guess my question is illustrated a little bit by the rest of the video that you just showed, in the sense that I hear lots of generalities, but the specifics are what I'm particularly interested in. And for example, David Lisbona's project of groceries, the telemedicine, these to me are more specific things that I assume the Smart City will be looking at. So I'd like to hear it on a more detailed level than I have so far. So
Well, more detail than what we've already given you is going to be developed with our research partners, because as I said, we're inviting the Cummings Center, we're inviting Nelly Foundation, we're inviting groups that deal with seniors to sit around the table and define exactly how the services should be provided to seniors who are living at home. Does anyone else want to comment on that? No? Okay.
Yeah, just if I can just
Go
jump
ahead.
in quickly, is that okay if I jump in?
Yeah, absolutely.
On
Go
that
ahead.
on that point, yes, a big component of this initiative is to consult with the public, because you're right, Daniel, is that the topic is very broad in and of itself, enabling people to live at home through with the use of technology touches on a lot of things. The video shows the use of sensors. That's one thing, and you're right about the specificity of the solutions. So the use of sensors really does one thing. It allows the city and partners to develop a passive monitoring system, basically saying, if these things are in someone's home, can we detect that a pattern is irregular? For example, someone hasn't left their bedroom in 10 hours, which is not a good thing. And if the resident wants to, after an amount of time, wants someone to be alerted at city services or elsewhere, and those are the situations that are going to be developed as part of the project, is how can sensor-based information of things happening within the home be responded to. And we've had many ideas in the project, and again, these have to be put together, but we can go from the idea of city services responding to such a thing, so a phone call can be placed or someone can be sent over, or potentially in a more connected network that maybe neighbors can be informed, that somebody has to be checking in on, Jim or Jenny and see what's going on that third floor, as an example. So acts of so things not happening, things happening. These are things that, in terms of a sensor-based environment, can be looked at. But you're right that groceries and commerce and things like that are emerging. Telehealth are emerging as well. There's a lot of things that I think are going to be discussed as part of this initiative to bring that specificity that you're looking for. Yeah.
I can just one comment. I heard Dr. Lawrence Rosenberg make a comment about bringing healthcare to the patient, which of course is a concept that I totally agree with. But I am mindful of the fact that what was called at the time the virage ambulatoire dates back to about 1997. And given what I know about the healthcare system in terms of making services actually available within the home, the ability to deliver on that wish, I'll call it, is limited.
But just to continue on that point, because Mark and I have, and the mayor as well, we participated in some of the sessions that Dr. Rosenberg gave just on digital health. And he's not talking about sending a CLSC nurse to your house. What he's talking about is monitoring your vitals, monitoring, sending patients home who have health issues and monitoring them remotely so they don't have to go to the hospital to get their blood pressure and their sugar level and their heart rate and everything else, right? It's all part of that. And also getting alerts, which are not always alarms. I love to say that because not every alert is an alarm, but getting alerts that are also going to trigger other responses, like Mark is talking about, be it from your family or your friends or your neighborhood. I mean, we have a whole corridor. I'll just finish with this, and I think Gloria wants to say something, right? So we have an entire corridor of high-rise buildings where our population is aging. And what are we going to do? Are those people going to just have to move out of their homes because they don't have services inside their condos? Or are we going to somehow make it more available to them through technology? I mean, to me, it's a tremendous challenge. I think that's one of the beauties of Côte Saint-Luc is we have this whole spectrum of possibilities because we have condos, we have apartment dwellers, we have people living in single family homes, and all of this is going to be explored in this project. Gloria, would you like to say something? I see you've turned off.
Yes.
Go ahead.
Yeah, I would. Has anyone considered the kind of services, digital or otherwise, needed to help people with dementia or an Alzheimer's in their home? Because that would be more than just monitoring from far.
Right.
Any thought to services like that?
Well,
or like the other fellow said,
these are the
could be few and far between.
That we're going to raise with the researchers, and we'll see if they feel that we should try maybe 1 or 2 pilot projects with people who have that condition. Obviously, I mean, yeah, go ahead, Mitch.
I just want to mention that I'm not sure if you're aware, but we do have, that's not technology based, but we have a drop-in center for individuals with dementia at the Aquatic Community Center, which we've had for the last 4 or 5 years. I think we had the second grant. I think it's back in operation. It was during COVID, it was off for a while, but now it's back. But the interesting thing is they come for activities, and they come in person for activities. It's stimulating and it's great. But it would be nice to see if somehow that could even be introduced to the home. I don't know enough about the topic, but what, Gloria, were you thinking about in terms of how we could help people with dementia through technology?
I was thinking that for somebody who was even alone in their house that didn't have somebody specifically to take them to a community center. I mean, I know people that have someone to take them to that program, but if they don't, how could they be monitored or reminded digitally to eat their breakfast, to open the door for deliveries of food, to put it away, to know where their bedroom was, to go to sleep, to have a nurse that has to come to help bathe them or put some food together.
Right.
Things like basic things to keep people in their home, which depends not only digitally, but on manpower as well.
Right.
Well,
That could be a big problem.
Mark would probably be able to answer that, but I think with an Alexa properly programmed and whatnot, we have some type of technology that they could ask questions and get answers. If it was properly programmed, like where's my fridge, or what am I supposed to have for dinner? I'm sure that probably could be programmed into some.
Well, it's something that we're going to work on in the project.
No, it's interesting because I know right now you can ask Alexa general stuff that's on the internet, but maybe it'd be more specific to their apartment. Yeah.
So I'm going to move on. Thank you, Gloria, for your question. It was very excellent, and we're going to take it into account in the research project. Eric, you have a question? Go ahead.
Yes, hi.
Hi.
I'm in a technology background, so I'm very familiar with the space. My question really comes down to and I understand the budget for this, or the money from the original grant is for research and development and everything like that. And I think it's a fantastic initiative, and I really think it's something we need to focus on as well. But where is the budget long-term coming from? Is this expected to be coming from the individual to pay for these services and whatnot? Or is this expected to be coming from the city? Like, are we as taxpayers going to be funding there's a significant cost, not only from the original equipment. The equipment is nothing more than, for all intents and purposes, capital cost, but the ongoing cost to manage, to service, the monthly fees that would go into this are exceptional.
Okay, I hear you.
That's part one.
I'm very, very conscious of taking that into account. So we've made presentations to various levels of government. We've made presentations to the federal. We've made presentations to the Quebec government. I, for one, have made this presentation to a roundtable of ministers and chefs de cabinet. And I can tell you that the Quebec government is extremely interested, and that's why they funded this research project, because for them, it's a saving. If ultimately if ultimately they can provide services through technology in a more efficient and and less costly way than what they're doing now, it's definitely a saving. It's not going to be a download. And certainly I don't see the city ever taking this on as a full responsibility, because it's not part of our core business. So I hear you, but as long as we're doing the research and we're implementing pilot projects, there are a lot of people out there who are buying all kinds of stuff off the shelf. They're just buying it and they don't even know how to use it, right? So that's another aspect that could be financed. There's lots of grants available for private entrepreneurs to get into this field. And I'm very much in favor of partnering with private enterprise for a private entrepreneur to come into this field and say, you know what, I'm going to open what we call a vitrine technologique, right? Just in the Cavendish Mall, and say, if you need to know what kind of technologies you want to put in your home to be better connected to social services. So I think there's lots of opportunity. I don't see it as a burden on the taxpayer at all. I think there's going to be a lot of financing available to do this type of thing. But right now we're in the, like I said, the research and phase with this grant. So we're not spending any city money on it. It's coming the grant.
That I understand. I was thinking more in terms of the long-term goal and concept, but from what I understand, then it's expected to be coming from a taxpayer, maybe not a Côte Saint-Luc taxpayer, but a taxpayer, if it's coming from the federal government or the provincial government, whatnot. It would be basically a social service funded from a social service perspective.
But also partnerships with private enterprise, because there's a lot of entrepreneurs out there who would they could have a niche business out of this as well, right? I mean,
but a private enterprise wants to get paid for their work, right? The definition of capitalism.
So we discussed all this during the implementation, and Mark can talk about it as well. There's lots of companies out there that are already pushing product, and that seniors don't know how to use. I mean, they're not using them, let's say, to their full potential. So that's why the city is a good platform, especially Côte Saint-Luc, because we are a defined territory, we have a defined population, we know our demographic. We're a very good interface between the heavy social service sector and the sort of, the base that needs these services. And like we partnered with Nelly, with the Nelly Foundation, just to deliver groceries, then so can we partner in the future with other organizations. I see that as a possibility. I don't see it as it becoming an expense or a burden on the taxpayer.
Can I add something, Dita?
Yeah, go ahead.
Yeah. I just want to mention, it's a really good question, Eric, and we actually spent a lot of time on the cost portion of the entire initiative, and the results of that, of our, let's call it our business model, or the operating model that we came up with, is part of the proposal that was submitted to the federal government in 2019. It's actually online and can be read by anybody. It's the model that we had come up with at the time was a tiered model. So if we take a comparable, like I believe it was called, or it might still be called, the PAD program, which is essentially that when an older adult needs their residence or their bathroom or any location in their home that needs special bars or special
ramp
or ramps or anything like that, there's a model that already exists whereby it's a sort of like it's a subsidy that kicks in. It's a subsidy that kicks in, but the based on applications, the resident pays a portion and the government pays a portion. So that model is one that we had followed because it was considered successful, or the roots of something that could be successful for something like this. And because we live in a world right now where if someone, senior or otherwise, wants technology in their homes, in today's world, they're actually paying for it. If somebody wants a smartwatch like a Fitbit or an Apple Watch that's connected to their loved ones, or they want an at-home monitoring service or anything like that. These are all subscriptions and payments that they take on themselves. The difference with what that is today and what the vision is for a connected city is that the difference is that today people pay for their own service. They might connect their own family members into that service through subscriptions like Lifeline or whatever. So they'll pay for that. There are very, very little, if at all, I think no subsidies or no government assistance to buy something like that, because it's not considered a medical necessity. So it's kind of this hybrid approach of seeing, and Dita mentioned it, is one is that there was a base that is, so there's a portion that would be paid by the resident or by the consumer, a set of services made cheaper by having economies of scale that the city would build in with partnerships. And beyond that, there are private enterprises, and Dita mentioned the private sector jumping in with sponsorships or specific partnerships to come see that there's a reduction for the city of Côte Saint-Luc's residents to kick this off, and that the model would then be exported or replicated to other cities. I'm giving a long answer to cover maybe what, 25 pages in the report, Dita, but really that's what it is. All the numbers are there, the breakdowns are there, and there was a lot of attention that was given to this. But, and it's still not done yet, the consultations that are going to, and the studies that are going to be part of the Living Lab project are going to even solidify this further, because residents are going to weigh in on the actual solutions and hardware requirements that are going to be needed. So long answer to say, this is like any company that goes through a business model question and how to bring adoption and low cost to the customers. So we had put some efforts in that direction, but more work is needed.
Yeah,
I
think go ahead.
I appreciate the long answer, and I think it addressed a lot of questions that I had, at least for the pilot project, which is great. The next question or next topic that always concerns me, again, from being in the space, is security, right? And the thing that triggered my mind, and privacy is particularly, the thing that triggered me was when Mitch had the wonderful term used, and he used Alexa as an example, right? For me, Alexa is exactly that. It's an example of what not to use and what not to do. From a privacy and a security perspective, it is known to be a disaster.
Okay.
And
so we're not using
those...
Alexa in this research project. We'll show you actually what we are going to use. It's going to be very much proprietary, like it's going to be customized. It's being developed at the Université de Sherbrooke and Université de Montréal. It's not Alexa based. But as I said, this is, at this point, we're jumping ahead of ourselves because we're not at the level that we were thinking with the Smart City project. Now we're just doing this basic research with the 20, pilot participants. So we got to take it one step at a time. But I can tell you that for the Smart City project, we engaged the top consultant in Canada on questions of privacy. And her parents happen to live in Côte Saint-Luc, right on Merton. It's very interesting. And she consulted us, and we can't show you her report because it's confidential. That was really interesting. We filed a whole report, but her part was absolutely top secret. But she advised us if ever we would, win the full project, that how to manage the security. We also, what happened in Toronto with that crazy, Google sidewalk project. I forget what it was called, but that was a complete flop especially because of the questions of confidentiality and security. So,
but as part of this project, then, is there, for all intents and purposes, a privacy commissioner that's part of this? Because I mean, again, working in the space, the biggest problem I always hear clients tell me is, we don't have to worry about this today. We'll look at that tomorrow when we're closer to a solution. The problem is when you do that and you get close to the solution and then you start looking at security and privacy, it becomes a disaster.
Okay, well, we're far from becoming a disaster. We're just starting. So I don't think that's going to happen. But the researchers that we have who are very, very, very capable and who are pretty expert in this field, are going to take care of that. Obviously, there's going to be waivers and consents and so on and so forth. But I don't think that, that's going to be, like I said, we explored that whole issue with Sharon Polsky, our privacy expert, and she advised us appropriately, and we're going to put all the appropriate measures in place. But I appreciate the comment because it was a major consideration. And it's,
okay.
That's clear. Yeah, I agree. So Lewis asked, to Eric's point, a large portion of the cost is going to be ongoing support, simple things like changing sensor batteries, support lines for the how do I, rebooting internet. Right. So we'll, like I just told Eric, Lewis, that bridge we will cross when we get to it. We are not at that bridge right now. We are using the $1 million over the next 3 years to implement this research project. It's no cost will be downloaded to the participants, not at this stage. So that's obviously always a consideration, but at this stage, we're not there. Does anyone else have any other questions? I see Heather on the call. Heather, do you want to say anything? Did you come in for any particular reason? You want to talk? You want to turn on your video? I don't know. I don't want to put you on the spot, but.
Hello?
Hi.
Hello? Can you hear me?
Hi. Yeah.
Yeah. No, I just wanted to, I just thought it was interesting. You told me about your Zoom meetings, and I just thought it was interesting, and I just wanted to hear what you had to say. And
excellent. Thank you very much, Heather. I appreciate you coming. I do.
Thank you.
So if anyone else has any other comments, now's the time. We're at 8:27. I like to sort of keep it to an hour. So afterwards, people can also watch it and know that it's not more than an hour. Some people do actually sit through all this. Does anyone else have any comments, any closing remarks? So, yeah, Daniel, go ahead.
Yeah, I just kind of like to summarize what I understand from what you and Mark particularly have said, which is that the focus here is on what I'll call the technological side, and the delivery of services that plug into that is the result that's desired, and the technology is how to get there. Is that a reasonable summary?
Well, I think so. I mean, but basically we're trying to keep seniors at home safely and securely and let them, live at home with peace of mind, because a lot of people are in that situation. We're talking really now about isolated seniors who live alone. That's our target for this project, and that's going to be the research, and by getting there is going to mean inviting community groups who service seniors to give their input as to how they think it should be done. Now we're going to have a survey. If you're interested in taking the survey, Daniel, Monsieur Matar, Vicky, all of you, Vicky asked me before where the service is not available, but there will be a survey. And right after the election, we will hopefully launch, and we'll put out the survey. And whoever wants to take that survey is going to give back the feedback that is necessary in order to go to the next steps. And also the community groups are going to be invited to participate as well, to focus the attention of the researchers on what needs to get done. So, ça va? Tout le monde est content? On est bien? Alors, je vous souhaite une bonne soirée, and I want to thank Mark for helping with the technical side, and the mayor for being here. Thanks for including me, Maxine. Thank you for coming, and thank you, David Lisbona. Et bonsoir. And next week, I want to announce, if you're interested, we're going to talk about Meadowbrook. It's lots to talk about, and we will bring you up to date as what is going on with that litigation. It's an ongoing litigation. Hopefully it'll be resolved soon. I'm crossing my fingers, but I just give you a little bit of the history, and any other subject that you want to bring up. Heather, if there's another subject you want to raise, I'm here for that. I'm offering this forum for anyone who wants to raise other topics that are of concern to residents in Côte-Saint-Luc. So feel free, and I invite you next week. And if you want, you can send me an email and tell me what you want to talk about. because, you know, maybe people like to talk about different things. So I see this as an opportunity really to have a good conversation. So, bonsoir. Merci.
Thank you.
Prochaine. Merci. Bye-bye.